COVID-19 has changed the world in ways that we haven't expected or we wouldn't have ever dreamed. Things that we thought were never possible back then has become possible, and things we took for granted have been all totally demolished. So, as far as healthcare facilities are concerned, health-seeking behavior has changed totally over the past few years, I would say. People who took symptoms for cough and cold very simple have now started to getting scared that what if they land up with COVID and COVID-related complications. So I think the general lesson that people have learned so far would be an increased health-seeking behavior, and they have learned not to take things for granted. People have learned to take better care of themselves, have given better thoughts to their healthy lifestyles, have chosen a healthier diet to eat. I think COVID has changed their perspective of life and has given them insight that their lifespan could be limited at any unexpected given time. So what are the changes that we have seen related to COVID in these past few years, especially among healthcare providers, is the advance in technology. Even in the most rural places, these days we have started seeing teleconsultation services, which has become a possibility. I think COVID has opened a new arena and a new window on these aspects because people who were technology illiterate have started becoming technology literate. Their health-seeking behavior has also improved in this aspect. I think these are some of the lessons that we have learned from the COVID pandemic in these past 2 years. My personal experience goes with technology is being employed in a private sector in a rural health setup. Getting a one-on-one interaction with patients on a technology basis had been a challenge previously. But now I think people are also open to the idea, especially like I mentioned in the rural areas. I was able to connect on a personal level with my patients. I was able to give treatment, get better follow-up from my patients on this technology aspect. And I definitely did see a better compliance of patients when there was a frequent follow-up over phone or over WhatsApp or on even one-on-one Zoom sessions in that way. Pregnancy generally itself, we consider it to be a little immune susceptible state where pregnant patient is susceptible to any kind of infections at that point. So during this COVID pandemic, I think the health-seeking behavior even among pregnant women has changed. People at home take better care of themselves so as not to infect a pregnant woman at their home, and a lot of myths and misconceptions among the dietary habits of pregnant women has also undergone a lot of change in these couple of years. They have opened their minds to the idea of better immunity provision for a pregnant mother depends on healthy diet. A lot of importance has been given to better nutrition and safe practices. We know that COVID is a highly susceptible state for pregnant women, pushing them into preterm labor. Vaccination among pregnant women is a must. So any and every patient must have a better awareness about COVID prevention and vaccination services, and definitely utilize their healthcare services better. So family medicine in general is basically a holistic care. So as a family physician, we are able to provide right from promotive and preventive health care to secondary and tertiary health care, even up to end of life care. I think in these days the idea of family practice in the general public has improved. Probably what the status was 50-60 years back, the concept of family doctor, health-seeking behavior, as well as trusting a family physician to go to in terms of need for counseling, in terms of need for communication for better health purposes. Everything has changed in the past decade, I would believe. Instead of having a fixed mindset of specialist healthcare provision, having a growth mindset regarding holistic care of family practice would be for the better benefit for the community as a whole.